The healthcare brick. What good government actually requires. Healthcare in America is not broken. That is not a comfortable statement, but it is an accurate one. It is strained. It is expensive. It is fragmented, administratively bloated, and structurally misaligned in ways that cost lives and savings simultaneously. But it functions. Imperfectly, unevenly, and at enormous cost. For most of the people it serves most of the time. Understanding the difference between broken and strained matters before we talk about fixing anything. Over the past year, this platform has published an extensive series examining exactly what the American healthcare system is, not what politicians say it is, not what we wish it were, but what it actually is. How the money moves, where the risk lands, who absorbs the consequences when care can't wait, why insurance and healthcare are not the same thing even though we treat them as if they are. That work is here if you want it. It will not tell you who to vote for. It will not tell you that one system is superior to another. It will tell you how the machine works, which is the only honest starting point for any conversation about changing it. So here is the healthcare brick. Not a policy prescription, not a wish list, just 3 honest observations. First, this is what we have. A layered hybrid system, part market, part public, part employer obligation, part individual burden, already half funded by government programs, already heavily regulated in some places and completely unregulated in others. Not socialized medicine, not free market, something messier and more complicated than either label suggests. Are we okay with it? Not as a political question, as a personal one. The system described in this series is not a conspiracy or a failure of compassion. It is a structure built over decades by people solving real problems with the tools available at the time. Layers were added for reasons. Each layer solved something and created something else. The honest question is whether the accumulated result still serves the people it was built for. Second, want is not a policy. Saying I want free healthcare changes nothing. Neither does I want to keep what I have. Want is not a funding mechanism. Want is not a transition plan for 150 million people currently covered through employers. Want is not an answer to what happens to hospital revenue when payment rates change overnight. The people who benefit most from the want debate are the people who need you distracted from the structural debate. As long as the conversation stays at the level of what we want, we never get to the harder and more useful question of what is actually achievable and how. Third, the realistic lever is insurance structure, not who builds the hospitals, not whether your doctor works for the government, not a binary choice between the system we have and a system that exists nowhere in the form being promised. The realistic lever is how risk is pooled, how pricing is negotiated, how the administrative layers between you and your care get simplified, how the 8 to 12 cents of every dollar currently absorbed by billing, coding, prior authorization, and claims processing gets redirected toward the care it was supposed to fund. That's where the flow can be diverted. The river doesn't have to change course overnight. You move the banks incrementally, and the water follows. It has been done before in pieces. Medicare negotiating drug prices, the ACA expanding Medicaid eligibility, surprise billing protections that took decades of advocacy to produce. None of it was fast. None of it was clean. All of it moved the river slightly. That is what structural change in healthcare actually looks like. Not a switch being flipped. Not a promise being kept. Just the slow, unglamorous work of redirecting flow in a system too large and too embedded to be replaced, but not too large or too embedded to be improved. That is the healthcare brick. Not the whole wall, just one brick, placed carefully, pointed in the right direction. The rest follows one course correction at a time.